All right, wonderful. We are recording. All right, so welcome everyone to our Power of Liquid Collagen. I think pretty much all of you know me, but for those of you who don't know me, I'm Sophie Alexander. I'm the owner and lead practitioner at the Nutritional Wellness Center. And I have a very special guest today with me that I am super excited to have here is Tara Lambert, who is the former owner of Nutritional Wellness Center and founder. And so those of you who don't know the story or the background, um, many years ago, I think it was 2009, when I was already dealing with chronic Lyme and chronic digestive issues, um, that I moved to Ithaca to study herbal medicine. And I was driving down Green Street in in Ithaca, and I saw the sign for the Nutritional Wellness Center, and I found my way there as a client. And it was life-changing for me. I mean, within a few months, I was no longer having stomach aches, and I just really knew I was on the right path for healing. It took more months because it had been so chronic with the Lyme, but I got rid of chronic joint issues due to Lyme disease, and it just went from there. Tara inspired me to go back to school for nutrition, and once I graduated with my master's degree, I asked her to hire me, and she said yes. And the really is history. Yeah, I mean, she was my practitioner through my first pregnancy, and then a few years ago, when she wanted to sell the practice and move to New York City, I was all in. And so I'm thrilled to have her sharing with us just what she has been doing currently. And Tara, I'm going to pass it to you for a little bit just to share more about that.
Thank you, Sophie. I cannot tell you how happy I am to be doing this talk with you. I mean, it's been, I think, 2.5 years since you bought Nutritional Wellness Center. I can't believe that much time has gone by. And the fact that we get to collaborate this way, I love the fact that things can be virtual and in today's world, and that we can still collaborate together this way, because I'm sure that I know most, probably not everybody, but most of the people tuning in. So it feels very special to be here today, talking to you and to everybody watching. And yes, I will always remember that fateful day. You were sitting on my table, and I don't want to use the word timidly, but you like gently let me know that you had graduated, and would I consider bringing you into the practice? And I played it cool. I had my poker face on, and I played it cool. And I was like, yeah, I think that would be a good idea. Let me discuss it. At the time I was working, collaborating with some other people. Inside, I was jumping for joy because I already had selected you. I was already hoping that you would want to work at Nutritional Wellness Center. And I mean, we worked beautifully together for years. Mm-hmm. And you very quickly became the lead practitioner. And then when I met my current husband and decided to move to New York City, it was the obvious thing to do, was to sell you the practice, and it worked out so well.
Good. Mm-hmm.
Thrilled. So, but as far as what I'm doing, so I want to speak mostly about the liquid collagen, but as far as what I'm doing now is I practice virtually. So instead of the brick and mortar practice of Nutritional Wellness Center in Ithaca, New York, I'm now in Manhattan in Midtown. And thankfully, right before the pandemic hit, I had just started to set myself up to see clients again virtually. And it was just the best thing in the world, because I was able to work throughout the pandemic. And we all know that people their health became more important to them, and the interest in health became even more important to all of us. So I was able to bring on clients and work with clients virtually through the pandemic, and I still do. And I actually focus on detox. My entire practice right now is very specialized. I do a 3-month program that is entirely focused on deep cellular detox and repair of the body at a cellular level. So I'm not doing the nutrition response testing that Sophie does anymore. And what I was doing at Nutritional Wellness Center, I'm doing something different.
Awesome. Thank you. Yeah. Wonderful to have you with us and to be talking about liquid collagen, right? Because collagen, super popular, I think, hot topic in the nutrition world. Very popular at Nutritional Wellness Center. We see great clinical results with it. And And so for those of us or those here who aren't as familiar with collagen, can you get us started by telling us more about what collagen is?
Sure. Is there any way I can see okay, there's the slides. Okay, because I can't see the slides and I want to follow the slides.
Oh, okay.
All these technical difficulties. So I do have my computer next to me. I did that on purpose so that in case I couldn't see the slide there, that I could see the slide here. I don't want to look away, but
Yeah.
I want to be able to see what you're seeing.
Okay. Yeah, it might be specific to you being on your phone.
Yeah, probably. So I've got it up for myself. So
Okay.
yeah, so what is collagen? So honestly, when we hear collagen everywhere, just like Sophie said, it is a hot topic. It is like blowing up and it's not new. Like I brought the powdered collagen into Nutritional Wellness Center, I think 10 years ago.
Yep.
If I'm recalling correctly. And it was a big deal back then, but it wasn't really known. It was like just when it was starting to come on the market. And I found a particular brand that I was super happy with. And I had great results personally. And I know that clients had great results as you're seeing. Mm-hmm. And at the time that was powdered collagen. And the reason why collagen is so important is that it is the most abundant protein in our body. So collagen is a protein, first of all, and proteins are made up of amino acids. And when people ask, well, what kind of protein is collagen? And the answer is collagen is protein. So collagen is a type of protein and it's the most abundant protein in our body. About 80% of our soft tissue, our connective tissues are made of collagen. And so that's, I said there, so it keeps the entire body strong. There's an image here. So if you're able to blow up the screen later, at any point, you can see exactly what it's made out of. But it's everywhere. It's everywhere in our body. It's our hair, it's our nails, it's our skin, it's our bones. There's something called epithelial tissue, which is, we see the skin on the outside of our body, but epithelial tissue lines every single organ of our body. So it's like the skin of our organs. So it's our digestive tract, it's our liver, it's our spleen, it's our brain. It's our eyeballs, our eyelashes, our eyebrows. There's like no part of our body that isn't made up of collagen because it's soft tissue and connective tissue.
Awesome. Thank you. And so, bear with me. Well, so speaking of that, so it's everywhere. So doesn't our body have plenty of it? Aren't we born with it?
If we're young.
Got it.
So yeah, we're born with an abundance of collagen. Literally from the day we're born, we start to lose collagen. Is a sad fact. Like the day we're born is the maximum amount of collagen we'll ever have in our entire lifetime. However, we have plenty of it until we're about the age of 25. Now, everybody's different, but somewhere between the age of 25, 28, 30, it starts to drop off significantly. And you can see that image here. And so I don't know if you've ever heard, I always heard, but I didn't know why. I always heard doctors say that basically we were getting better through life until approximately the age of 25, meaning we were growing, we were I say there may be some people who are still young watching this. For the rest of us, we're pretty much all over 30. I'm 46, turning 47. So our bodies are basically building and developing until approximately the age 25. Everybody's different. And then from that age, we start to break down. And I never knew exactly what they were talking about. And now I know. They're specifically talking about collagen and hyaluronic acid, which I'll explain hyaluronic acid in a second. We start to lose it around 25 and 30. And after the age of 30, it starts to decline rapidly, about a rate of 1% to 2% every single year. And after the age of 65, it's pretty significant. So if I could go back in time, like I started taking collagen 10 years ago, I'm going to explain the difference and why liquid is so important. I make a joke is like, if I could go back in time, I would start taking this when I was a fetus because we just wouldn't age, bottom line.
Awesome. Thank you.
You're welcome.
So where do we get collagen?
Right. So food sources. So we can only get collagen from animals. And I just want to bring up that point because I get asked all the time if we can get collagen from a vegan source of it or a vegetarian source. And the answer is no. And there's a lot of confusion out there on the market because there's a lot of marketed vegan collagens or vegetarian collagens, and it's creating confusion. And so the vegan or the vegetarian collagen, they're collagen boosters. So that means like vitamin C, for example, is a collagen booster. So there's certain nutrients that we can take that can boost our body's ability to produce collagen, but it's not a collagen in and of itself. So the only sources of collagen are animal, and it's connective tissue. So there's no difference whether it's a chicken, a cow, a pig, or a human, or a fish, or a bird. It's connective tissue, it's soft tissue. So we have to get it from animal soft tissue. And so that's going to mean, for example, the skin of an animal, the bones of an animal, the hoofs of an animal. I'm keeping it to like the ones that are more palatable because once we get to the differences, you'll see that they actually use anything. They'll use the eyes, the hair, the fur. They'll use places where we wouldn't know things that we wouldn't necessarily want to eat, but as long as it's made out of connective tissue, that's a source of collagen.
Yep. Great. Yeah. And that's why we see clients do so well when they're regularly doing bone broth too, because it's such a wonderful source of that collagen.
Yeah. I would say that's the cleanest source that you can make for yourself.
Yeah, totally. Right. But this gets more into the nitty gritty of it, right? Like, so we can get it from all these places, but how well do we actually utilize it? Like if we're supplementing with collagen, yeah, how well absorbed is it?
Not well absorbed at all.
Yeah.
And I don't know about you, but I've read online and I've actually had mentors of mine discuss with me that collagen isn't a really good source of protein, regardless of the marketing, because we only absorb 15 to maximum 30% of it. So that's the powdered collagen. So I put a picture of the powdered collagen there, and I'm not going to show any brand names, but I have a container. And so we're looking at powdered collagen here. So when we're talking about powdered collagen, when we're talking about bone broth, when we're talking about those sources, they are beneficial. So I don't want anybody to, once we get into the later part of this conversation, I'm not saying that powdered collagen or bone broth isn't effective and that it doesn't help us, because it does. And we see that. I know that 10 years ago, when I introduced the powdered collagen into the practice and into my body, I saw an immediate improvement. Mm-hmm. And also, like you just said, we do so well on bone broth. We've recommended that to our clients for as long as Nutritional Wellness Center has existed. Exactly. And we see that people do well. And so imagine if you're doing well at 15 to 30% absorption, and that's such a small absorption rate. Imagine if we could actually absorb more of that. And what I want to explain is the reason why we have such a low absorption rate is that the collagen molecule itself, the way that it exists in nature, is huge. It's a very large molecule. And so going back to when I was saying about a mentor of mine, several mentors and teachers who would discuss with me, like, why do you give your clients collagen? It doesn't really get absorbed by the body. And I would answer, well, I see a noticeable difference. And we would get into the science of it. And basically the science of it is that the molecule itself is enormous and it doesn't really penetrate into the cell wall. And we have to also digest it. So if we have any kind of digestive issue with our stomach, our intestines, our liver, right away, we're going to absorb less. So if we could maximally absorb 30%, if we have any kind of digestive issue, we're going to be absorbing less than 30%. And then if our body's membranes, the cell membranes of our bodies aren't in good shape, then we're going to just absorb even less. So it just keeps going down, 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 down the amount that we absorb. Because that molecule, just think of it as like a basketball, basically. And we're trying to get it through like a tennis net, like the little holes in a tennis net, and we're trying to shove a basketball through those holes. It's not going to fit. And that's what occurs when we're taking bone broth or powdered collagen. We're trying to get that into our cell walls.
Okay, got it. So tell us how liquid collagen is different, right? as we say,
Right.
new generation of collagen.
The
So
new generation.
yeah, so what makes the liquid collagen so different?
Oh, I was actually gonna have some. I might get some if that's not weird. But I'll talk about this. What makes it so different? So what makes it so different is the size. So what this company did in particular is it made the molecular weight of the collagen molecule small enough that it's absorbed into our cells through the bloodstream. And it's very, very specific science, because if the molecule's too large, it won't absorb. And if the molecule's too small, it won't absorb. So it has to be, it's kind of like a Goldilocks effect, right? It has to be just right. So it's the Goldilocks effect, where this molecule is just the right size, so it fits through the holes perfectly and it penetrates our cell walls through our bloodstream. So that's one thing. And there's 7 patents on that science alone. The size of the molecule, there are 7 patents on that. So it's very protected. The next thing that makes it so incredibly different is that it's not just collagen. So we're talking about collagen, this word collagen, it's the buzzword, it's everybody's talking about it. And the powdered collagen that we were just discussing is just collagen. Now, it's unfortunate that even if it says it's organic and even if it says that it's grass-fed, it can come from like the scrapings on the floor. Like, how hot dogs are made?
Mm-hmm.
It's kind of like that. It's like hot dog collagen, because it can still be USDA organic and it can still be grass fed, but it's literally the snouts, it's literally the hoofs, it's literally the bones, the skin, just like all the parts of the animal that's not used elsewhere is collected because it's connective tissue and it's made into a powdered collagen. So the collagen that we're talking about is none of that. It is extracted from a single source, and it's sternal tissue. Okay, good. Thank you. Yeah, I'm going to go back and forth between these 2 slides because the conversation basically interweaves.
Right.
So it's a sternal tissue. So the sternum is the breastplate. Now in a chicken, it's a little bit lower. So it's coming from a chicken. It's coming from the sternum, which is the breastplate. It's coming from one piece of the sternum, so single source. Is 100% natural, meaning there's no other ingredient added. And the kicker is what I was just saying, it's not just collagen. What it is it's a matrix. It's a matrix of collagen, hyaluronic acid, and chondroitin sulfate. And that is what human cartilage is made out of. And so this particular area of the chicken, this little tiny piece of sternum tissue from the chicken, is what's called the most similar, bio meaning life. So it's the most similar to human cartilage of anything out there. Like, there hasn't been found a different type of cartilage that is more bioavailable to the human body to use. So basically the body sees it as its own. So it thinks, oh, that's me. And it absorbs it straight into the bloodstream. It absorbs it straight into the connective tissue, into the joints, into the skin, into the brain. It crosses the blood-brain barrier. It is used by every cell of the body. And because it's not just collagen, it's that matrix of collagen, hyaluronic acid, and chondroitin sulfate, it does more than just act like a protein. So I'm going to back up for a second. Hyaluronic acid, if people don't know what that is basically, that's what hydrates us. So that is what plumps up our skin. It's what plumps up our organs. It's what keeps us looking youthful. When you're a kid, babies, how you grab their cheeks and they're just so plump, and it's just so enjoyable to grab those cheeks. You want to eat them. And that plumpness that you're feeling is hyaluronic acid. And so basically we have the most that we're ever going to have when we're born. And then it slowly decreases over time. And if anybody here is familiar with, it's so popular right now to get fillers, for instance. So the things that they inject in women's face, that's hyaluronic acid. It's naturally occurring in our body, but we lose it as we age. So our faces, they start to sag. and our faces get less plump, and our body starts to sag, and our body gets less plump. And then our joints, it's very important in the synovial fluid of our joints, because it's so hydrating, it literally keeps the fluid in our joints. So instead of rusting and getting creaky and getting sore, it keeps us very fluid, and it keeps us the ability to move comfortably without pain. So that's hyaluronic acid. And then chondroitin sulfate is just needed by the joints. It's in our skin as well, but it's very much needed by the joints. So it's not that these things are synthetically added, because there are some collagen products in on the market that will say collagen plus hyaluronic acid, but they actually added synthetic hyaluronic acid to it. And that's not the case with this particular collagen. It exists in nature this way. This matrix exists in nature naturally as a threesome. And that way the body just absorbs it and uses it as its own. Did that make sense?
Great. No, that's super helpful. Thank you. Yeah. And is it correct that this, because it's so small, right, then it's much more highly absorbed, correct? So,
yeah, that word bio-optimized
yeah,
is such a great word, because that's what makes it absorb, because that's what the patents are on, is making that size. So that everything I just talked about, the collagen, hyaluronic acid, chondroitin sulfate is a matrix as one molecule. Okay. And then that molecule is basically created, is shrunk down. So instead of it being a basketball, it's going to be like a pea.
Yeah.
And so instead of trying to shove this large molecule through the net, you're going to be very easily passing that pea size through the net, and it's going to go straight into the cell wall.
Awesome. Great. So yes, as you were saying, what else can it do for us?
So before that, because I get asked so many questions, let's go back up to
Sure.
Is it a clean quality product?
Yeah, please.
Because I'm just going through like the questions that I get asked all the time.
Yeah.
And so you and I, we're the same. We're so, it's like everything has to be organic.
Mm-hmm.
Everything has to be clean. And if we're going to use a supplement, we're going to study it like crazy, like do our research and study it like crazy. So this was no different for me. I'm talking to you and your public. So, the number one supplement brand that we use is Standard Process.
Yep.
And that's a whole food supplement. And that's the best way to describe this. This is a whole food collagen, right? It's the same concept of it not being a synthetic and not being created in a laboratory other than the size of the molecule, but it being extracted from nature. And then in doing so is like, it's very important that it's clean and it's not going to be contaminated. It's not going to be, it's very important that we don't have glyphosate in our food and in our supplements. And so this is not organic because there simply isn't enough chickens out there to provide organic source at this volume, but it is non-GMO. It is no antibiotics, no hormones. It's non-GMO. It only comes from chickens in North America. It's hydrolyzed, it's sterilized. It's only coming from the sternum, which means it never touches a blood source. It doesn't touch nerves and it doesn't touch blood. And that's important because that's where the diseases are carried. So cartilage doesn't have that blood source. So like the diseases don't even touch this tissue. So I did such a deep dive into this company and such a deep dive into this product because I specialize in detox, right? My program now specializes in detoxification. And I work with the sickest of the sick. I work with the whole range, but I literally work with people that nothing else has worked for. So I'm dealing with incredibly sensitive people. So I'm not going to make a recommendation to somebody that is going to be sensitive to this product, or I'm not going to introduce basically hormones or antibiotics or pesticides. That's
Great.
really important.
Yeah, thank you for clarifying that, because it is, and that's a big thing that we talk about regularly in appointments.
Yeah, and that's one of the things is that the collagens can be contaminated with the glyphosate. And most people know what glyphosate is, but some people don't. It's a pesticide made by the company Monsanto. And mostly people know of it as Roundup. And it's one of the most dangerous chemicals on the planet. And it has contaminated our air, our water, our food. And unfortunately, when we're dealing with concentrated products, that pesticide could be concentrated in the product.
Correct. Okay. Understood. Okay. We good to
We're good to go.
talk about your before and afters now? I'm so excited about this part.
I know, this is the best part.
Yeah. So tell us more about the results you've seen and what it can do for people.
This has been life-changing. I mean, it has been life-changing for me personally. It has been life-changing for my clients. It has been practice-changing for my practice. These photographs are of my people, like that, the eye that you see, that's my mom. So and that's my mom at 80 years old. And it's because after the age of 65, the sharp decrease of collagen hyaluronic acid in the body is so significant that it could take somebody up to 6 months to see the difference when they start to take liquid collagen. This is my mom at 6 weeks.
Wow.
So that is incredible. And it just, she told me that she told me it's after the fact that her upper eyelid was bothering her so much. It was so heavy. And it was interfering with her vision. She was literally about to make an appointment with the doctor to have surgery on her upper eyelid to give her more comfort and more vision. And then we started on the liquid collagen. And now look, I mean, her eyelid is, it's like unbelievable to me that her eyelid is that tight. And so she never called the doctor and she never had the surgery.
Awesome.
And then the picture on the right, that is one of our colleagues. So that is a doctor of chiropractic, and she's one of our colleagues that we know well. And now I don't want people to get the wrong impression. Not everybody responds this quickly, but that was 4 weeks for her. So, and you can see that not only did her hair grow back quickly, it grew back darker.
I know, I do observe that.
Yeah, incredible. So yeah, so just again, these are real people. These aren't like taken off of some sort of like promotional site. Like these are my clients.
Yeah.
And then the next page.
Yeah.
Yeah, that's my thumb. So you can just see how dry my thumbnail was. And that was 2 weeks. And again, I don't want to give the false impression that everyone is going to see results in 2 weeks and 4 weeks and 6 weeks. The clinical trials were done for 90 days. And depending on the health of the body and depending on the age of the person, it's going to take less time or more time. So I've been working on my health for a long time. So I responded very quickly. All of my clients, I'm doing more than just liquid collagen. We're doing an entire program. So they tend to respond pretty quickly. But just so that you have a realistic expectation, it could take up to 6 months. But generally speaking, I say 90 to 120 days. The middle picture is my mom again. So, you know, we all have that turkey neck, and that's my mom, and I have the turkey neck developing, and I'm like, oh, that's my future. But now it doesn't have to be, you know, hers is turning around and I can feel that mine's tightening up. And then the picture on the right is my client, Cindy. And that, I don't remember. I think that was a month.
Okay. Great. Thank you.
And the next picture.
Yep.
So it works everywhere on the body. You know, these pictures, we got the neck, the eye, we got the belly. You know, if we've lost weight and we have saggy skin, if we've been pregnant and we have saggy skin, you can just see how it regenerates the skin tissue. And then the hands, so psoriasis and eczema. Now, keep in mind, I'm not diagnosing. I always put this in every video I ever do. I'm not a medical doctor. I'm not diagnosing. I'm not making claims. I'm literally just showing photographs of people's progress and the diagnoses that they've been given by their medical doctors. So we're talking about eczema and psoriasis and things like that. And so these pictures of the outside of the body are so significant because we can't see pictures of the inside of the body. And what's really important to know is when you see that visual change on the skin, that's also what's happening internally. So that's what's happening to the joints. That's what's happening to the muscles. That's what's happening to your fascia, which is connective tissue. That's also what's happening to the organs. So the brain, for instance, like I've never been, my thinking is so clear. I notice a significant difference in my ability to think and the sharpness of my thoughts after starting this. Also the energy levels, because it's feeding the cells, the nutrients, the protein, amino acids that it needs. So immediately the mitochondria, which are the energy powerhouses of the cells, they're going to fire, they're going to work faster and produce ATP, which is energy for the cells to work. And then the energy that the cells produce helps those cells to repair themselves and work properly. But that all of that, it creates energy, it creates well-being. The organs repair themselves, digestive issues repair themselves, joints repair themselves over time.
Yep. Super exciting. Thank you for sharing these pictures. So how does it work? How do you take it?
So it's liquid. And, if it's not too weird, I'm going to go get it because I meant to do that before.
Sure. Yeah.
So I'll let you talk. I'm going to go grab
How
your
long are you
bottle.
going to be gone?
30 seconds.
30 seconds. Yeah. Okay. Cool. Well, yeah. So as Tara's talking about, it's liquid. I've been taking it personally for about a month now, and it's very easy to take. So she's going to describe. But one of the best things to do is just to be really consistent about it and treat it just like you would your other supplements. So you take it twice a day, and just measure it out in a specific amount, and because you have to drink it. It's got a little sweetness to it. I'm sure she'll talk about that. It's not got added sugar or anything like that. They put stevia in it. Okay, that was fast. Yay. All right.
What were you talking about?
I was just saying that I've been taking it for about a month now. So I was just sharing that, and that it's very easy to take and just be regimented with it like you are your usual supplements.
Have you noticed any change yet?
I haven't. No, not that. I mean, I haven't gone back and compared pictures. But I am distracted about my own body. I'll be honest, just having small children. So I must be honest, I just haven't paused and reflected on it. Yeah.
Actually, I'm really glad that you said that because I was just sharing all of these incredibly fast results. And I just want people to know that everybody responds to it at a different time frame. So I'm actually really glad that you said that you're not noticing a difference, because that's normal too.
Yep.
And you're younger. Do you mind saying your age? I don't want to
Oh yeah, no, it's fine. If I can remember, I'm about to turn 39. Yeah.
Right. Oh my God, I can't believe you're 39. You're in your 20s when we met.
Yeah.
We must know each other for close to 20 years.
I don't even.
I don't know. Is that even
my children and then deduct a couple of years? It's been, well, it was 2009. 2009 was when we met. So
okay, so 10, 12 years.
I don't know. I can't do the math.
Yeah. Okay, so not 20 years. It feels like 20 years.
It feels like a long time. Yeah.
In a good way. Yeah, but no, I'm so glad you said that you're taking it for about a month and you haven't noticed the difference, because a couple things, you're super healthy. You didn't take this, you didn't start taking it because you blew out your knee.
Right.
You didn't start taking it because you have dry eyes. You didn't start taking it because you have joint pain. Like, you are already a super healthy person without a whole lot of pain and without a whole lot of body issues. And so for someone like yourself, it's going to be more about maintenance rather than seeing some sort of dramatic change. Like I said, I'm not even joking. If I could go back in time and start taking it as a fetus, I would. I would take this as early. I just wish that I had known about this, because I had nice benefits from the powdered collagen, but nothing like what I'm experiencing now. And what I didn't talk about in the early part of this was all my health problems. And I have lifelong health problems, from as early as I have memory. And I have really gone through the ringer, and I've had some very serious health issues that I've had to recover from. And in doing so, that means that I've explored like everything out there, whether it's conventional medicine or alternative, I've explored it. If it's a supplement, I've taken it. If it's a treatment, I've done it. And so for someone like yourself who hasn't been in that situation, it's going to be more about maintenance. It's like how lucky you are to start taking it now, because it's literally just going to slow down the aging process. We can't stop the aging process, unfortunately, but you're going to just slow down that aging process and pretty much just take a look at yourself in the mirror today. And that's it. You're going to stay like that. So 20 years from now, when we do our next video on whatever device we'll be doing it on in 20 years, you're going to look like you do today, or pretty close to it. Now me, I have a lot of joint pain. Mm-hmm. I had, over the last 3 years of, it's actually almost 4 years ago now, I had a very sudden, acute, mysterious illness, which I now know was a poisoning. I didn't know it at the time, but I was poisoned by a substance and I didn't know it. And it just sent me, in a domino of health crises. But as a result, I aged very rapidly. Like I aged overnight, like 10 years overnight. And then once I discovered what had caused that and I recovered my health, I still had the fact that my body was damaged. I had, 4 years worth of damage basically from that occurrence, which means that I aged fast. My skin was sagging. I was getting jowls. I was getting the turkey neck. I had these dark circles under my eyes. I was losing the plumpness on my face and my joints hurt. And I mean, now it's just like a completely different story. And that's why it's so important to take those pictures. And so before we jump to that slide about the pictures, the reason I went and ran to the refrigerator is that this is what it looks like. It's liquid. It's so easy to take. You don't have to remember to take a supplement. Although if you're Sophie's client, you're going to remember to take your supplements. Now I poured a full glass of it, but you only need 15 milliliters, and 15 milliliters is right here. So it's very little. I do like the shot glasses because what I found is that people were not taking enough of it. And just like anything, it's dose dependent. If you take a little bit of it, will it help you? Yes. But are you going to get the full results? No. So you really want to get the full results. So you can also use a tablespoon, but you have to use a baker's tablespoon. And that's this, you can get off of Amazon. It's a baker's tablespoon. But honestly, I put the link in here to get the shot glasses because these work every time. You can see it. You can make sure that you're taking the right amount. You just need to take the 15 milliliters twice a day, morning and evening. It's best if you take it like a collagen, any collagen, whether it's liquid or powdered, has a life of 12 hours, a half-life, they call it, of 12 hours in the body. So if you just take it once a day, it's only going to be in your body for 12 hours. So it's only going to be working at repairing and rebuilding your body for 12 hours. So that's why you want to take it twice a day. You can take it with or without food. You saw me run into the back and get it out of my refrigerator. You do, once you open it, you want to keep it refrigerated. This is a food. It's, it's a whole food. It needs to be refrigerated just like any of your food does. And I'm just looking because I can't see on the screen. Mm-hmm. Okay, I covered it.
Yeah, you did. That's great.
And the next one.
Mm-hmm. Yeah. So yeah, can you take, right. So if you're get benefit from the 15 milliliters, can you take more of it?
Yes. So I have become extremely conservative. After I had my toxic exposure, the longer I've been a nutritionist and the longer I've been in my career, the more conservative I've become. And I really low dose supplements or have people not take supplements at all. And so this is literally the only area on my program where I say more is better. Every other thing that I'm doing with the person, I'm always like, either don't take it or you're just going to take this very small dose. And with the liquid collagen, I'm like, if you want to guzzle the bottle in one day, go for it. So they've done studies on it. The dose that will get you, the studies that were done, that there's 37 clinical human studies, and that's significant. It wasn't done on rats. It wasn't done on anything else. It wasn't done in a petri dish. It was on humans. Some of them had over 100 participants in these studies. These were huge studies, 37 of them, clinical trials. These are third-party, peer-reviewed, double-blind, placebo-controlled, and they're PubMed studies. So these aren't just, small little studies. So they studied everything. They studied, how fast does it enter the bloodstream? What percent of hyaluronic acid, how much does that increase? It increases 6,000% the hyaluronic acid. Wow. I think within a month's time, but like most of that is happening in the first week. And that's why people they'll text me and they'll say, I've been on it for 5 days and I already feel better. How is that possible? It's not that the body has repaired itself in 5 days. It's that the hyaluronic acid has increased the synovial fluid in the joints. And then therefore that inflammation in that joint, that bone on bone isn't happening. So they're getting immediate relief. So that was digressing, but just to say they did studies on the correct dose. And the correct dose is 15 milliliters in the morning, 15 milliliters in the evening. And they've also done studies that you can't overdose. Like it just keeps improving. So it really just comes down to cost, like how much you're willing to spend, because I drink a full one of these like twice a day or 3 times a day, because I have a lot of time to make up for. I have a lot of damage in my body that I'm making up for. So for me personally, more is better. Okay. And what else on that page? I can't see.
The average person, if they're taking 15 milliliters a day, like how quickly do you go through it, or how much do you need to have?
Yeah, perfect. 2 bottles per person per month. Okay. So if you do the math, if you look at the bottle and you do the math and the 15 milliliters, it's exact. It's 2 bottles per month per person. So if anybody's doing less than that, will you get benefit? Yes, but you're not getting maximum benefit.
Okay. Thank you. All right. So we talked about this a little bit, but if you just want to reiterate, like how long till people see results, and how long to give it a try before judging it.
Yeah. So the clinical trials, the human clinical trials were done for 90 days. And so we know factually that you want to give it a minimum of 90 days. And then like you and I tell our clients when they start the program, you want to give everything you do a minimum of 3 to 4 months, because that is a healing cycle of the body. So the red blood cell has a lifespan of about 3 to 4 months, and that equates to one single lifespan. One single healing cycle in the body. So whether you're doing liquid collagen or some other program, just like anything that you do, that's a rule of thumb, 3 to 4 months. And so I tell everybody, give it 90 to 120 days minimum. The older you are, or the more chronic or severe your health conditions, the longer you want to give it. So some people, I tell them, you want to give it up to 6 months before you judge it.
Okay.
And it's one of those things where I want to under promise and over deliver. Mm-hmm. Because if I under promise on the time frame and then I'm getting a text from somebody 5 days later that they're already noticing certain differences, or 2 weeks later, or a month later, or 2 months later, that's exciting. And it's exciting to both of us because they're getting results early on. And that's pretty common, as you saw by the pictures.
Yes. Yes. So Steve Z had a question for us, Steve.
Yeah. Hi, Steve. Hi.
Well, and so we had 2 questions coming in. So Steve was wondering, do they extract this from live chickens? And if not, why not? That was his question. And then another person came in with a question about, do you recommend this for the rest of our lives?
Heck yeah. Can I be any more enthusiastic? I would have cursed, but I figured I shouldn't. Heck yeah, I will never be without this. If you can't tell how enthusiastic I am about this, I need to emphasize this is the most important singular supplement that I have come across in my 20-year career. Now, I have access to the best products on the planet. both Sophie and I do. I can have an account with any company I want. I have access to the best companies on the planet. I have access to the best products on the planet. And there are a lot of really good products on the planet. This is the best singular product, meaning, just one supplement, as opposed to a company or a whole bunch of supplements, just one single supplement. I have never seen a single supplement do what this does. Like, I've never been so excited about a product. I mean, Sophie, have you ever seen me so excited about one single product? Never. It has changed my life. That is why I'm so excited, because I can't emphasize how much damage occurred in my body over the past 3 to 4 years. It was devastating. And it was very upsetting to me, because my physical body changed visibly, and it changed physically, like how to get through life in that amount of pain. And I've been on this product for about 2.5 months. I'm now back at gymnastics. I'm doing back bends. I'm doing handstands. Like, I can't wait until I get back on my skateboard. That's basically my goal, is to be able to, because I had an injury occur in my back. I have not exercised for 4 years. Like, that's how significant, like, I had a severe injury to my back. I've not been able to exercise for 4 years. I'm doing gymnastics, people. There's pictures of me on my Facebook page doing back bends and handstands. Like, I never thought I would be able to do that again. And then on my appearance, it's like, I'm watching myself age in reverse. Every morning I get excited to look in the mirror instead of dreading looking in the mirror, because my skin's just a little bit tighter and just a little bit plumper. It's very, very sweet. My husband, who's turning 50, he doesn't even like to acknowledge that. We wake up in the morning and he grabs me and he like hits my cheek and he's like, "You're spring chicken." Because he sees the difference. Yeah, sorry, I got a call. Because he sees the difference, and he's like constantly like, like hitting me because it's bouncy like a baby,
I understand.
So I know that seems like I'm digressing from the question. It's just the point that I want to make is, yes, I am going to take this for the rest of my life. Anyone I love is on this product. So that means my mother, I always get the terms, my mother-in-law and my stepmother. So both of them are on it. My father-in-law, my husband, like all of my clients, is literally part of my program. It is part of my program. It's not optional. Like, anyone I love is on this product, and I will be taking it for the rest of my life, and my mother will be taking it for the rest of life. And George doesn't have a choice. He's taking it. And so now to answer Steve's question, it's a great question. I actually get asked questions about similar to that, and it's a great question. So no, definitely not a live chicken. It's extracted from the sternum. It's a byproduct, basically, because these are chickens that were already, they're meat chickens, basically. So they were already raised and slaughtered for our meat. And so they're already being killed and used for their meat, and whatever other parts of their bodies are going into various food sources or pet food sources. So it's extracted from chickens that are already being grown and slaughtered for other purposes. And it is extracted after they're dead, but it never touches any blood and any nerves.
Thank you.
Any other questions coming?
No other questions coming through. So why don't we move on and have you talk about taking your before photos?
Yes. So you see, the one that I picked was great because she actually made a collage and she put day 1 and day 90, which is so nice. Mm-hmm. I can't emphasize enough how important it is to take your before pictures. It's literally mandatory if you're my client that you take your that you take your before pictures, and you even have to do a before video for me. So that's up to Sophia. She's going to make you do that. And nobody wants to. I didn't want to, nobody wants to take their before pictures. And then once they get their, I don't even call them after pictures. I call them progress pictures, because we'll take them in a month, 6 weeks, 8 weeks, 12 weeks. You just keep taking your pictures. I promise you, you will be astounded, because I'm thinking of 2 instances right now of people who swore to me that they saw no difference. They were like, I don't look any different. I hope it works. It doesn't seem to be working for me. I don't notice any change. And so I suggested to them, well, why don't you take a progress picture and send it to me so that we can compare them? And then I put it in like pick collage and put it side by side. And it is so dramatic. Like both of those people were shocked, because when you see yourself day to day, you're not seeing the difference. But then when you see that side by side comparison, that's when you see the difference. So take your before pictures, please, and of various body parts. So your face, the neck, the eyes, bellies, cellulite, saggy knees, saggy elbows, anywhere where you're going to see a noticeable change to skin, hair. If you're thinning, if you've got some thinning hair, eyebrows, eyelashes. My eyelashes are so long. Can you see them? Yeah. Now, granted, I genetically, I got them from my dad. I was blessed, but they're out of control. Like everybody that I meet who doesn't know me, they will literally ask me if my eyelashes are real. And yeah, they were long before, but not like this. Like this is insane. My gums, the gum recession and the gum pockets, like all of that. I don't have any more gum pain. It's incredible. But what I was going to say is also make your list, because we can't take pictures of pain. We can't take pictures of what's happening on the inside of the joints, right? We can't take photographs of that. So if you have joint pain, if you have brain fog, if you have low energy, if you have trouble thinking, if you have sore muscles, if you have fibromyalgia types of discomfort, if you have, what else? It's truly endless, but you get the picture. So make a list, because then you want to compare your list in 90 to 120 days also.
Right. Yeah, so you've been talking about it. I've already gotten a couple messages. One person had to leave early, but she was like, how do you get it? And I said, I'll email you, don't worry. Why don't you tell us more about that?
Yeah, it's so simple. Just get in contact with Sophie. If you're Sophie's client, you're watching this, you're Sophie's client, get in contact with Sophie. She's got it available. She'll hook you up.
Yeah. At this time, it's not something I'm going to have sitting on the shelf in the office, but I will explain to you how we'll get it to you.
Yeah, it's very, very easy.
Yeah. And I know that's everything. Any other questions? Anything else anyone wants to know or ask Tara while we have her here? So we did it. We were just in an hour.
Oh, that's pretty good. I know I can talk. So I'm glad we did it in an hour. Yeah, please, if anybody's watching, if you have questions for me, please ask.
Yeah, thank you so much for sharing this information, Tara. You know it so well, and you talk about it so eloquently and very clearly. So thank you, and very passionately. So I know you get all jazzed up about it, which is wonderful, because I'm very excited about it too.
Yeah, I'm so excited that you have it available to your clients, because it seems like it's relatively new. I guess that's another point. I'm just thinking of the questions that people ask me when I introduce it to them or we start discussing it. A lot of times people will say, oh, is this new? And it's not. So, the research and the development behind this product is 25 years old. So it's not a fad. It's not new at all. It's just that it's finally gaining popularity and gaining the acknowledgement that it deserves. So the research behind this particular product is 25 years old. And then like the powdered collagen, they got popular. They started hitting the market around 10 years ago. And then over these past 10 years, it's just become more and more and more popular. And as more people had problems digesting, because that's the other thing with powdered collagen, sometimes people have digestive issues and they can't, because it requires your digestive tract to digest powdered collagen or bone broth. So if you have a gallbladder issue, if you can't digest protein or you can't digest fats, it can be complicated. So the liquid collagen, I completely forgot to mention, it absorbs sublingually. So it absorbs straight into your bloodstream underneath. There's Gemma. Hi, Gemma. So it bypasses the digestive tract completely in the sense that first of all, it's a liquid. And second of all, the low molecular weight is able to absorb straight into the bloodstream in your mouth. So our digestion begins in our mouth. And so if we hold it, like, it's not required. So absolutely not required. You can just drink it. You can drink it with food or without food. But if you hold it, and just swish it around your mouth, it instantly absorbs into your bloodstream. So I've had people who had digestive issues, and I've actually told them, hold it in your mouth. And this, I'm even hesitant to say this because I don't want somebody to misunderstand. Please swallow it. But this particular person had a particular issue. And so I had them hold it in their mouth and actually spit it out because of their particular issue. Now, everybody else out there, please swallow it. But the point is, it's so highly absorbable that you can absorb it straight under your tongue. And that technology has been around for 25 years. So It's not a fad.
Yeah. And Sue's wondering if it replaces bone broth.
Yes, absolutely. You could still do bone broth if you like bone broth. Like if it's something that you enjoy, go for it. But as far as it being a source of protein and as far as it being a source of collagen, yes, it replaces it for that purpose.
Great. Okay. Awesome. No, that's no other questions at this time. So, but if you think of other questions later, we can get them answered. But we'll appreciate you all being with us for this hour. And thank you so much, Tara, for being with us. Oh, I see one more question popped in, so I'll answer that.
I can actually see them now too. That's cool.
Oh, okay, you can? Great. Steve says Randy wants to know more about leaky gut.
Yep. Okay, so it bears repeating. I probably should have repeated this several times throughout that. It's just because of the litigious world that we live in, and I just have to do this.
Yeah.
I'm not diagnosing. So when we talk about leaky gut or we talk about any other diagnosable issue, I'm not a doctor. I'm not diagnosing, and I'm not curing. And I'm not suggesting that this particular supplement could cure you because the FDA says that no supplement can cure you. Yeah. So now that I've said that, so the gut lining is made out of epithelial tissue, which is very similar to our skin tissue. And so epithelial tissue is made from connective tissue. And so since this particularly helps the body to repair connective tissue, yes, it helps to repair the lining of the intestines and the lining of all of our organs. Oh, and that makes me think of another question is like, what there's so many different types of collagen. There's collagen 1, 2, 3, 4, and so on and so forth. So this collagen is primarily collagen type 2, which is what the joints and cartilage is made out of. But when they use that matrix of with the hyaluronic acid and the chondroitin sulfate, and they shrink the molecular weight, and it goes into the bloodstream and into the body then produces type 1 and type 3, which is mostly in the skin and the epithelial tissue. And this isn't just an opinion, it's actually the clinical trials showed that. So it's basically, it's one of the marketing or selling points of a lot of the powdered protein, and they'll say it's type 1, 2, or type 1, 2, and 3, or type 1, 2, 3, and 4. So this is primarily extracted. Well, it is extracted from cartilage, which is type 2, but then when it goes into the body utilizes it like 1, 2, 3, and 4. And that's shown in the clinical studies. Like the science backs everything. And then, what I've always said, and you too, like we are in the front lines. We are clinicians, and I can read research until the cows come home, and I can find it interesting and fascinating, but it only matters if it works. Like any research that's out there, it's only as valuable as it gets results. And so being on the front lines, it has to work. Any product or recommendation that we make, it has to work. It has to get results for our clients. And this gets such results that it's so visible that we ask you to take pictures.
Yeah, exactly. Got to document it.
Yeah, document it like crazy. Oh, I want more questions. More questions, please.
Oh, I know. I'm not thinking of anything right now, and no more have come in. So
Okay.
I think we will, no, we'll wrap it up and just, this was so fun. Yeah. Definitely have people saying they're interested. And so, yeah, I'll just repeat. I think the easiest way is if you're interested, I'll make note of it right now if you want to send me a chat, but also email or text the office and we will just explain to you how to get a hold of it. Yeah.
Perfect.
And well, yeah. And if there's lot more interest, then we'll do this again, Tara. We'll chat about it more.
I was just going to say that, it could be the first video of many, because it's not complicated, but it can seem complicated because of the misinformation that's out there. Like anything, collagen's a buzzword, and with it being popular and with it being a buzzword, that means there's going to be a lot of marketing, and that means that there's going to be a lot of misinformation, and it can get confusing quickly. Like, why is one better than another? Why does it work? Does it actually work? There's a lot, like, it's like kind of endless questions.
Yeah.
So just to say, you can see how enthusiastic I am. And, I have such a special place in my heart for you and Nutritional Wellness Center that I would do as many lives as you want to. And there's other things too that you and I haven't even started talking about.
Yeah.
With this particular collagen that are doing some other phenomenal things that are just changing my clients' lives in such a wonderful way. So I could come back and talk about those too.
That would be awesome. All right. So to be continued.